Okay. And what do you have on hand?
1 gram.
1 gram, that 1,000 milligram.
So you have 120 milligrams from the first calculation, okay? And then on hand, you have a gram or 1,000 milligrams, right? Is that right?
Mhm. Yes,
For how many mLs?
250.
Okay, so 120 divided by 1,000 times 250 equals what?
0.12.
Your answer should come out to 30. Yes, no, maybe?
Correct.
Okay, everybody
Yeah, I
understand
got
why
I
we
got
did it
the
that
survey.
way?
Yeah.
Everybody understand why I did it that way?
Okay, it's asking for ml per hour, so you gotta convert the minute. 2 milligrams per minute. That means there's like 60 minutes in an hour. So you gotta times the 2 milligram by 60 minutes, right?
Correct,
Okay.
because it's asking you for mLs per hour.
Yes, per hour. Okay. It's just because it had that per 1 minute. I thought it didn't make any sense to time it by 60 minutes because that's, more than the 1 minute. So that's why I got confused with that.
It's fine. I mean, you got to figure it out because you haven't done it in a while. So I
Yeah.
do keep it simple, stupid math. So, I'm going to do it the simplest way possible because I don't like math unless you're paying me. Okay, so let's look at number 14. Now, again, 14's asking us the same thing, right? mLs per hour. What is the flow rate? mLs per hour, right?
Right.
So you have 4 milligrams you're giving every minute. You have to convert that minute now into an hour. So you're going to do the same thing, right? See if you
That's
can do the math and figure it out.
70 times 60. No, not 70. Oh yeah, we are in number.
It'd be number 14,
14,
4 times 60,
4.
right?
4 times.
4 times 60. Okay, so 240 divided by 2,000.
Correct. Times 500, right?
Yes.
And what'd you get?
60. Okay. I got it. 60. 60 mLs per hour.
Okay, I didn't do the math, but I'm taking your word for it. I can do the math though, just to make sure that you're right, but I'm pretty sure you are if you did the steps I told you. So 4 times 60 divided by 2,000 times 500. Ooh, times 50,000 I put in. That ain't gonna work. Well, my calculator's acting stupid. Let me do it on the computer one. Did everybody else get 60? Or nobody else did it?
Yeah, I got 60.
Okay, then you guys are right. Oh, now it wants to work. Okay. Okay, I got 60 now. All right, now it's working right. Okay, let's go to number 15. Okay, first thing I'm going to tell you about number 15 is about the military time versus standard time. Okay, so if it has a colon in it and PM or AM after it, it's not military time. Okay, because military time has no colon and it has no PM or AM after it. If it's 9 a.m., it'll say, oh, 900 hours. If it's 9 p.m., then you would take 9 and add 12 to it. And that gives you what? 18, right? So 9 p.m. in military time would be 1,800 hours. All right. Is that right? Did I do the math right?
21, I think. 21.
Whatever 9 plus 12 is. I need a calculator at my old age to add now.
1, yeah.
All right, so it'd be 2,100 hours, okay, at 9 p.m. Any time between 1 p.m. and 11 p.m., you add 12 hours to. That gives it to you in military time, okay? That's just for your knowledge if you have to calculate something in military time. Now, for this problem, what kind of time did we start in?
Regular time.
Yeah,
So unless it tells you otherwise, you're going to end in regular time. If it starts,
that was my issue
end
with
in
that
regular
one.
time.
That was my issue with that one. I took the test twice. The first time I'm like, wait a minute, they have 9:05 p.m. They don't have, 2100. When I took it the second time, I'm like, because I had a couple wrong and I couldn't figure out which one it was. And then maybe they want 2359 and I switched my answer.
So here's the rest of the calculation now, okay? So you have a pump going at 70 mLs an hour with a volume of 200. So you have to figure out how long it's going to take to infuse. So first thing you have to do is take your total volume of 200 and divide it by 70. And that's going to tell you how many hours that it takes to infuse, which came out to 2.85 hours. Now you have to round that up to the nearest tenth, which becomes 2.9 hours now.
Right.
Okay. It's 2.9 hours, not 2.9 minutes.
Yeah, 2.9 hours.
Now, in order to convert 2.9 hours into minutes, okay, well, you already have 2 hours there, so you only need the 0.9 converted. So if you add 2 hours onto 9:05, that brings you up to 11:05 p.m., right? But they're saying the answer is 11:59 p.m. So that means you got 54 minutes unaccounted for somewhere. So take your 0.9 and multiply that times 60, because 0.9 represents a fraction of an hour. And you have to convert that fraction of the hour into minutes. So the way you do that is you take that 0.9 and you multiply that times 60. And that should give you 54 minutes. So when you add that 54 minutes onto the 2 hours, now it comes out to 11:59 p.m., right?
Mm-hmm. It was 9:05 plus that 54 minutes.
Correct. All right, any other math questions?
Yeah, I have a question, Miss Susan.
Yes.
If we are just joining the class late, if we are to approximate, let's say we are using the weight of a child and we are converting from kilograms to pounds. Let's say for 20 kilograms, then we have to change to pounds. We get 9.090909. If we are using that to continue solving the question, do we approximate it before using, or we use the whole value?
All right, hold on a second for that question. Let me see if I can find, because you're from the days, right?
No, I'm from the evening class.
Oh, this is Prince. Okay, you got that cheat sheet I sent you?
Yeah, I
That
received
should-
the cheat sheet.
That
Am I
should
reading?
tell you about the weight approximation.
No, I
You're not
didn't
going to be doing weights right now anyway, but you shouldn't have gotten any weight problems, did you?
No, with the question 15, for example.
Question 15.
Question 15, the one you just solved.
Okay, let's go back to it.
Yes. With the timing, when I changed when I changed it to 7, I'm coming, let me get my screen. Medication is 70 ml per hour.
Do you need me to go back over this one?
No, please, I'm okay with that.
Okay, which one, which question are we talking about?
With the 2.9, it's a very big number. It's 2.8. Let me see. That's 70. Yeah, it's 2.85714. It continues like a
But what does the instructions say?
Yeah, round to the nearest 10th.
Right. So in order to round to the nearest 10th, we take that 2.85 and we round it up to 2.9. Because that 0.85 is going to represent not just minutes, but also seconds. And we don't need the seconds.
Okay. So we run it to 2.9 and then use the 2.9 to continue solving it, right?
Yes.
Oh, okay.
So now how do you convert 0.9 into minutes?
You multiply by 60.
Okay. So then you should come out with 2 hours and 54 minutes.
Yes.
And if you add that to 9:05, that brings you to 11:59 p.m.
Okay.
You can't go into the military time because we started with standard time. So you have to stay with standard time unless it tells you otherwise.
Okay, thank you. And then to
Okay.
number 4, please.
Number 4.
Yes.
Okay, number 4, the doctor orders kanamycin 200 milligrams IM. This is injection, okay? Whenever we give an injection,
Okay.
if it's less than 1 ml, we round it to what?
To the nearest 100th.
And if it's more than 1 L, we round it to?
To the nearest 10th.
Okay. So now whenever we reconstitute, okay, whatever we end up with, that's what we have on hand. So in this case, we ended up with 1 gram per 3 mLs. That's our dose on hand. Our physician order dose is 200. So our need dose is 200. That's our desired dose, 200 milligrams.
Okay.
Okay. So we put that 200 over the 1 gram per 3 ml or 1,000 milligrams because we're going to have to convert it. All right, so it was 200 milligrams over 1,000.
Yeah.
Divide, and then we multiply times 3.
It 0.6.
That was your answer, 0.6.
Yes.
Okay, if it just came out to straight 0.6, I didn't do the math, but if it just came out to straight 0.6, then there's nothing for you to do there.
Or we wouldn't add a 0 to make it 100.
Yes, if it's less than, but they didn't do that here. So let me see.
Because I was comparing this to question 2. Question 2 is also an IM injection. There's also an IM route, which is also an injection. But that one was approximated to the nearest 100. Since
So if this had came out to be like 0.66, then you would have to round it up to 0.6. I mean, you would have to know what the next number is to round it, okay?
Oh,
If it came out to 0.66. But since it came out to 0.6, it would be 0.60 if you were going to write it out like that. But
Okay.
typically, because it's less than 1 ml, it really should be rounded to the nearest 100th, not the nearest 10th, because it's less than 1 ml.
Okay.
What was the other one you were asking about?
No, I was comparing this to question number 2.
Yeah, so when you do number 2, you get that long number because you got
Yes.
0.4 on hand. I mean, ordered. Sorry, I always say those backwards. I'm just so dyslexic when it comes to that. So we have 0.4 on hand and I mean, ordered, and we have 0.6 on hand. So that brings us out to 0.666 infinity, right?
Yes.
So on that one, you're going to round it up using that third 6.
Okay.
So let me do the share. This is what you're going to have. Zero 0.4 divided by 0.6, and that gives us this 0.66666. So you're going to use this 6 to determine this number. So that, and it's times 1 because it's 1 ml. All right, so that's going to give us an answer of 0.67 because it's less than 1 ml. It's an injection. We got to round to the nearest 100th. And since we have 0.66666, we use that third 6 to determine what that second number is going to be. You understand that? You go with that? Anybody else have a question about that?
Yeah, we're good.
Anybody else have a question about that? Okay, any other math questions?
Okay, Miss Susan, the last question. It's about the cheat sheet you give us. With
About the what?
The cheats, the mass,
The cheat sheet.
the cheat sheet, yes.
Okay,
With the tablets, if it is scored,
so if the tablet's scored, you round it to the nearest half tablet. Okay?
okay.
So how
Yes.
this works is, let's say you have 1.2 tablets, you would round it to 1. If you had
Okay.
1.5, you would give 1.5 tablets. If you had 1.6 or higher, you would give 2 tablets.
Well, if you have 1.6, what if you have 0.7?
0.7 would go to a whole tablet.
You wouldn't give 0.5?
Why would you give 0.5?
Instead, we run it off to the nearest half.
Yeah, but when you're going up, I have to look at that, but I'm pretty sure you would go to the whole tablet.
But okay, well, the nearest half to 0.7 is 0.5, not 1.
Yeah, but you don't go down when you're rounding, when you have a 5. You don't usually go down, you usually go up.
But if the tablet is scored, if the answer comes up to 0.5, can't you just give half of a tablet?
But wouldn't you be given under the dose? So I don't
Oh,
think
well,
you can.
I-
I have to look at that cheat sheet, but I don't think so. I think if it's 0.6 or 1.6 or higher, it automatically goes to the next whole tablet.
No, what if
Look at
your
the
order
cheat sheet
asks
and I'll
for,
clarify that.
what if your order asks, I mean, your order or your math comes up to 1.5, or can you
Then
just,
you would give 1.5.
okay, that's what I mean. Yeah.
Where's that cheat sheet I sent you guys? Let me see if I can find that cheat sheet, because it has the half tablet calculation on it. The cheat sheet that I sent you.
This is what he's asking is it's only if your answer come up to like 1.07 or something, or 1
No,
point.
the answer comes up to be 0.7. The cheat sheet says we round it off to the nearest half if the pill, if the medication is scored. So getting a value like 0.7 to the nearest half is 0.5.
The nearest half would be up, going up. The nearest half will be up to the whole tablet. Because 0.7 is more than 0.5. So if the nearest half, meaning the nearest half higher up, because it's 0.7.
Yeah, I don't see that you could go down. But I want to look at the cheat sheet, and so I got to find it.
Okay.
And I got to go into my other computer because I sent it from a different computer than what I'm in. And so it's not populating up for some reason. The email is screwy. If you don't use the email from both computers and you can't see it on one, sometimes what I sent on another. I don't understand that, but. I sent that to you guys on Wednesday, right?
Yeah, Wednesday, 9:54.
Do you have it in your email? Can you send it back to me? Because I don't see it for some reason. It's not populating in my
Okay,
email.
okay. Yeah, I sent it.
Okay.
You're welcome. Okay.
It didn't send an attachment, whatever you sent. It didn't
Huh?
include the attachment. I got your email, but it doesn't have the attachment.
Okay, let me read that.
Oh, I got it. Never mind. I got it on my own email.
Oh, okay. No, I miss wait.
Oh, I'm sorry, I had it wrong. I said he's doing his schoolwork. I don't know what to say. Yeah, get out of here.
Zoom does not like to open stuff, so it takes all day. Can you guys see it?
Yes. Oh, wait, where did it go?
It was there and then it went away.
Thank you. How much did they loan you? 800? 800,000. What? No, $800. That's good. Jail authority ran his 40 car, came back. His father is registered to a 40 count. I guess that could be what. Just like that, because right, I'm saying that this kid killed 5 people for $800. Fight that gun will go.
Okay, can you see it now?
Yes,
Yes.
the rounding rules.
Yes.
Yes.
So it says right here, 0.8 tablets equals 1 tablet. So 0.7 is going to be the same, right?
Run it to the nearest half.
Prince, you don't round down. The only time you round down is if the number is less than 5.
The nearest half, that's closer to the whole tablet, Prince. Closer to the 1 tablet, not closer to the half tablet. Rounding up. 0.7, you're going up to the other half of the tablet, meaning closer to the whole tablet.
You can only round down if your number is less than 5 anyway. You can't round down. All right, but you guys probably won't get questions like that. I really wanted to give this to you about the injections, but it's good rules to know. These are current rules in nursing right now for rounding. But I haven't seen any where you have to round up or down on the tablets. I mean, most of the time, you're not even going to get tablets on your calculations because you're beyond that. You're doing
1.2 was
IV
round.
drips. You're not doing tablet calculations right now.
Okay. But the 1.2 was rounded to 1 tab.
It was rounded to 1 tab points because it's a 1.2. So it's lower than 5.
Yeah.
You run it up
0.2
when
is
it's
less.
0.5. Yes, 0.2 is less. You can go up, but you can come down. But if it's 0.7, then you go up.
So if it's 1.3,
You still
You
gonna
end up-
do 1.
You still give 1 tablet because
One
it's less
tablet.
than half tablet. 0.5 is half a tablet, Prince. And then 0.2 or 0.3, that's less than half of
look,
the tablet.
rounding to the nearest 0.5, if you have 1.2, it will be 1 tablet. If you have 1.3, it becomes 1.5.
Does
No,
not.
no, it doesn't. 1.3 is still 1 because it's less than 5.
The only way you run it up is when it's higher than 5. But when it's less than 5, you remain at 1. Do you
If you
understand
have-
that, please?
If you have 0.5, a
That's
number
it.
to the,
It's-
0.5 is 0.5. That's just half a tablet. You just break the tablet in half. Just like you have 100, you break it in half, that's 50. You have a whole tablet, it's scored in the middle. You will need to give half, you break it in half.
Your basic rounding rules say if the last digit is greater than 5, you have to round up. If it's less than 5, you have to round down. You have to go by the
Yep.
last number. Okay, let's move on. Any more questions about math? All right, let's get to the midterm. Okay, it starts with the drug calc. Can you guys see my screen?
Yes.
Yes.
Okay, we're gonna start with these questions and then I have some more on another slide for you. Okay, the physician has written the following order for a client. Okay, carbenicillin, 500 milligrams IM every 6 hours. The medication requires constitution. The label information indicates the vial contains 2 grams when reconstituted with 5 mLs of water to yield 1 gram per 3 mLs. So how much do we have on hand? Come on, rock stars. You know this. How much do we have on hand?
2,000 milligrams after it's reconstituted.
Yes.
So we got the 2 gram.
No, I asked you, how much do we have on
I
hand?
think I just so fast. I think I just so fast. See?
Because in order to do this calculation, you need 2 things, right? Your doctor's order, which is carbenicillin, 500 milligrams IM every 6 hours, and what you have on hand. So what do you have on hand?
I think it's the 2 gram.
1 gram.
You have 1 gram per 3 ml, right?
Mhm.
Okay. Now, please be honest with me. Who's having a problem understanding that?
I was, but I got it now.
Okay, so take the fluff out because we have this vial, right, that has 2 grams. And the reason why it has 2 grams in it is because we're going to use it a couple times. So we're going to add the 5 mLs to it. When we add the 5 mLs to it, we get 1 gram per 3 ml. That 1 gram per 3 ml is our dose on hand. So whatever we end up with is our dose on hand.
Okay, so 500 over 1,000.
So, yep, we have 500 milligrams over 1,000 per 3 ml. So you should have ended up with 1.5. Is that what you got?
Yes.
Anybody didn't get that or doesn't understand? I can't help you. I'd rather you be wrong now than on the test. Okay, 1.5. Okay, we have gentamicin, 80 milligrams and 100 ml normal saline to be administered over 30 minutes. Drop factor is 10. Okay, just read what the question's asking you. That's going to tell you how to set up the problem. The nurse sets the flow rate at how many drops per minute. So it's asking us for a formula in drops per minute. Whenever we do drops per minute, it's always total volume over total time in minutes times the drop factor. So our volume is always going to be in what?
ml.
ml. And our time always has to be in what?
Minutes.
In minutes. So we have 100 divided by 30 times 10. And then we're rounding to the nearest whole number because you can't give a partial drop.
33.
Everybody get 33?
Yes.
Good. Okay, nurse is working in the critical care unit. As a matter of fact, let me let you guys read. We got 11 people up here, right? That'll save my voice for today. So how about if, we just start and work our way around the room. Everybody can read a question. Maybe if I call people's names, I guess, then that will help so we don't get any confusion. All right, so let's start with Tanika. Go ahead and read this question for me, Tanika.
Okay. A nurse is working in a critical care unit where the focuses on primary care nursing. The nurse demonstrates understanding of primary care nursing when, let me just read all of them. Is it C?
Providing all aspects of nursing care for assigned clients. Does everybody else agree with that?
Yep.
Okay, good job. Okay, next, Mary. You're going to read, Mary. Are you there, Mary?
Yes, I am.
Okay.
A nurse forgets to raise the railing of the bed of a client who is confused after taking pain medications. The client's attempt to get out of bed and suffers a minor fall. The nurse asks a colleague who witnessed the fall not to mention, hold on, I can't say that word. Hold on.
Not to mention it to anyone.
Okay, not to anyone because the client only had minor bruises. What will be the
appropriate action
of the colleague?
So how many of you have ever witnessed something like this? Where your friend or your colleague says, oh, don't tell nobody that happened. Nurses do it. So no other steps need to be taken because the client was not seriously injured. Is that true?
No.
Nope.
You have to write an incident report at very least. Why?
Because you don't know what's going on internally.
And because even if they only had a minor incident, okay, you know, especially if it's an older client, they're going to have huge bruises. If they're on any kind of blood thinners, that can make a difference. And what happens when the family or someone else comes in and they see these bruises on the client and you have no documentation or explanation for it? That's going to create an issue, right?
Yes.
Okay,
A
so
bigger problem.
the colleague should inform the nurse that a full report of the incident needs to be made. Is that true?
True.
Yes.
Yeah,
True.
we definitely
Yes.
would want to do a report. Anytime you don't do a report, I guarantee you it's going to bite you in the booty. The colleague should monitor the client closely for any adverse reactions of the fall.
No.
Well, you probably should.
Yeah, you should. You should, but
That
you
might not be our most appropriate answer, but you probably should. Okay, the colleague should report the incident in a peer review of the nurse. Is that appropriate?
No.
All right, I would probably go to the supervisor and report it to them unless I was a supervisor. Then I would pull that colleague into a room and I would have a discussion with them about why the right thing to do is document, because you protect yourself when you document a fall on the patient, because later the patient could come back and say that or the other thing to them, and now you have no documentation to protect yourself. What do you
Ms.
think
Loach.
is your best answer? Yes.
In reference to answer C, I mean, I was interpreting it to mean like if the colleague, the person that witnessed the patient that fell is the one that should be, or the nurse itself should be the one monitoring for adverse effects, not the person that saw it.
Well, true. It should be the nurse. That's right. That's a good perspective to bring to it. Okay. So that's a good reason why that's not the right choice also, right?
That's how I was interpreting it, yeah.
Good. So really, I mean, listen, Judge Judy says if it doesn't make sense, it's not true. So really the only answer here that makes sense is B, right?
Yes.
Yes.
Okay, good. I like that you're able to pull little stuff out of there. That's a really good interpretation. And this is what you have to do to answer these questions right, is find those little cliches in there and pull them out. Why isn't this the right answer? What is the purpose of evaluation in the nursing process?
A.
Oh, I was supposed to be having you guys read. See, you got me reading the questions. You're supposed to remind me. This one don't want to act right. Okay, good. A. All right, who's supposed to read next? Lucrece.
Okay.
The American Nurses Association recommends adherence to defined principle when delegating care tasks to unlicensed assistive personnel. According to these principles, who is responsible and accountable for nursing practice? Is it A?
The registered nurse?
Yeah.
Okay, good.
Yeah.
Okay, Lori.
Okay, an elderly client has been admitted to the hospital with a diagnosis of failure to thrive. Client has become constipated in spite of maintaining a high fluid intake and taking oral stool softeners. Client states she feels mortified to attempt a bowel movement on a commode at bedside where staff and other clients can hear. The nurse should respond by modifying which of the following resources? Personnel, environment, client and visitors, equipment. So by modifying which of the following resources? I think environment.
Sure. I mean, this is even a problem if you go into a public bathroom, right?
Yeah.
And you got to do something other than pee. You're trying to make sure that the bathroom's empty before you start your little commotion, right?
Yeah.
You don't want other people hearing you or smelling you, right? And you don't want to be hearing or smelling them. Good. Okay, Roxanne.
According to Maslow's hierarchy, a client who has physiological needs will benefit most by meeting those needs when the nurse provides which of the following? D.
B as in boy.
D as in dog.
D as in dog.
I agree with that one.
Okay, good. Okay, next is Anita.
And a nurse is recommending a cardiac rehabilitation program to a client. This health promotion behavior is an example of which type of prevention? A, secondary prevention, B, tertiary prevention, C, primary prevention, D, latent prevention. Cardiac rehabilitation, the health.
So when we think about cardiac rehab, okay, this is something that someone's going to go to generally after they've been in the hospital and they've had either heart failure or heart attack or something along that lines. Okay, something happened with the heart and now they're going to go to like a long-term care facility and they're going to get rehabilitation and learn how to manage this chronic issue. That helps.
B.
Correct. I agree.
Tertiary prevention.
Good.
Where would be there better?
Brittany.
A client is scheduled for surgery for an abdominal hysterectomy. During the preoperative assessment, the client states, "I am very nervous and scared to have surgery." What client outcome is the priority? Evaluate the need for antibiotics, resolve the client's anxiety, provide preoperative education, or prepare the client for surgery. I would probably say B.
Okay, good, because that increased anxiety is also going to cause stress. So we need to be able to answer these questions before we take that client back. All right, so we're going to have to notify the surgeon so that he can answer if unless it's a standardized question, which usually if they have that type of anxiety, it's not. Okay, next up is Eugene. Eugene, you with us? All right, how about Bobalyn?
What are specific, measurable, and realistic statements of goal attainment?
Nursing diagnosis.
Yeah.
So, you know, this is part of your whole care plan. When you design your goals, okay, they have to be specific and measurable, because if they're not, we can't really determine whether or not the client met it. So you can't just say that you're going to return their vital signs back to stable in 2 hours or by the end of the shift. Okay, because first of all, I don't even know what stable vital signs are for that patient. So you could say something like, patient will be able to walk 100 feet on 2 liters of oxygen without desatting less than 92%. Because I can clearly, specifically, and measure that, and then you're going to give me a time by the end of the shift or by the end of the week or within 48 hours. Now that's a specific and measurable goal. Okay. Nursing diagnosis, okay, that tells you about the things that are going wrong with that patient. So your nursing diagnosis is catered to that problem that they have, and it's going to be related to some malfunction in the body.
So would it be the outcome criteria instead?
D?
Yeah, D.
D, it would be the outcome criteria. Okay. And then you evaluate that patient. So you set that goal for them to walk 100 feet within that 48-hour period, right? And let's say they don't. Then on your evaluation on your care plan, you're going to write patient unable to meet goal. Okay. Able to ambulate 100 feet. However, O2 sats drop down to 90%. Okay. So he partially met the goal. He was able to ambulate, but the O2 sats couldn't be maintained at that 92% or above. So when you're doing a care plan, especially when you get to that bottom section of the care plan, it's going to say subjective behavior, objective behavior. And then it's going to ask you for that residual, that contextual, and that focal stimuli. And then it's going to have a place for a nursing diagnosis. And then your goals, and then your interventions and your evaluation. All these things have to be married together. Okay. So your subjective is going to be anything that that patient tells you. Your objective is only things you can see. You can't see shortness of breath, so don't put it there. Okay. What can you see that tells me my patient is short of breath?
The way they're breathing, using excessive
All right. So labored breathing, blue dusky nails. They might have blue dusky lips.
Low pulse ox.
Okay. So those things tell you that my patient's hypoxic or that they're short of breath. So those things you can put because they're observations. An objective statement has to be an observation. Now your focal stimuli is going to be what brought the patient to the hospital right now, or what brought them to the doctor's office right now. Okay. It wasn't the congestive heart failure. It wasn't the renal failure. It wasn't the heart attack. That's not what brings them to the doctor's office. Okay. Because we don't start out in congestive heart failure, right? We start out doing stuff we're not supposed to, which causes us to have a problem with the heart, or we have a medical condition that we're born with or something that causes the heart to have a problem. So that causes us originally to go into that congestive heart failure. That's our medical diagnosis. Okay. Our nursing diagnosis is this fluid overload that's caused by the congestive heart failure. Okay. The heart's not pumping, so I've got fluid volume overload. Now, really, the reason why I came to see you is because I'm short of breath and I can't breathe. Because when I can't do stuff that I normally do every day, that's what brings me to the doctor, right? I could be in this congestive heart failure for 2 years, but as long as I can breathe okay, am I coming in there?
No.
No, I'm not coming in there. Okay. Unless I have a problem that starts to affect me every day, I'm not coming in there for that. Okay. But when I can't make love, when I can't breathe, when I can't dress or feed myself, then I'm coming to see you. Okay. So that's what makes it that focal problem. It's that immediate problem. Now, what things contributed to that focal problem? That's your contextual stimuli. Okay. So if I was in congestive heart failure, that would contribute to my shortness of breath, correct?
Yes.
If I had fluid volume overload, that would contribute to my shortness of breath. If I'm eating a ton of things like salt substitutes loaded with potassium, could that contribute to my shortness of breath? Yes. If I'm eating a lot of just salt that's causing me to retain water, could that contribute to my shortness of breath? Yes. What other things are contextual stimuli that, and I don't want you to answer this, I just want you to think about it. All right. And then residual stimuli are things that I'm not really aware of that are affecting my condition. So things like my age. If I'm 75 versus 33, the congestive heart failure might have more of an impact on me. If my culture is to eat certain foods, that might have a more of an impact on my fluid overload and other things going on in the body. And then also ethnicity, okay? Because let's say older people, for example, you know, back in the day when your mom and dad first got married, more than likely your dad worked, but not your mom, okay? Depending on your age. Like when I was a kid growing up, you know, it was standard for dads to work, but not moms. Okay. Moms stayed home. They took care of the house. They took care of the family. They took care of the kids. And part of that taking care of was doing things to comfort us and make us feel good. And one of those things that people do to comfort us and make us feel good is feed us, right? Now, when I'm feeding you, I'm going to feed you the foods that make you feel good. What kind of foods is that? That's those comfort foods, those cultural foods, okay? So it's the foods I like, but is it necessarily food that makes me healthy? No. So here, my husband's in congestive heart failure, but I want to make him feel good. So I'm giving him this salty fried chicken or these salty collard greens, okay? Or what other fried, greasy, fat foods and stuff. And I'm actually killing him. But I feel secure that I'm making him feel better because I'm giving him my love. I'm putting my heart and soul into this food. And of course, when he gets in the hospital, okay, because now he's in a hospital and he's your patient and he's up here with this congestive heart failure. And, you know, the wife calls to check on him. Hey, honey, how you doing today? I'm not too good. Why, honey? Well, they got me on this bull crap diet, you know, 1,500 calories a day, no fluids. You know, I'm hungry. I'm thirsty. Bring me something. So, you know, on the way in, she stops and grabs him something that makes him go worse into fluid overload. But she thinks she's doing a good thing because she's making him happy and trying to comfort him. Okay. So this is why you have to know that all these things, they go together. What nursing interventions am I going to do to resolve that fluid volume overload? Because I need to resolve that in order to fix my patient's shortness of breath. So I'm going to have to do things like restrict salt, restrict fluid, do some breathing techniques, maybe give the patient oxygen. I might have to give them some sort of diuretic. And that is not my only choice, by the way, for removing fluid, because sometimes it's not a diuretic issue. Sometimes a diuretic's not going to work. So I got to figure out what things can I do to improve this patient care. Okay. And that's why you need to know about this criteria. You need to know how this thing is all married together. Okay. And then once I set those interventions, now I can set goals based on those interventions. So if my goal is to restrict the patient's fluid, I would want to teach the patient how to eat a fluid restricted diet. I would want to teach the patient how to recognize and eat a low sodium diet, because these are interventions that I need them to follow. They're interventions I put to place as the nurse, but I need them to continue these when they go home so that they can meet these goals. And then when I go back to evaluate the patient, if they were able to meet those goals, I should see an improvement in their overall health status. So I wouldn't want to do things that aren't going to fix what my nursing diagnosis is. And this is what I see where students make the biggest problem on their care plan is they'll put a nursing diagnosis there, but then the interventions don't correlate with what the nursing diagnosis is. So their interventions they're doing isn't going to fix the patient because it's not the same. It's, you know, one set of interventions and a different diagnosis. So think about that because this all goes together even when you're doing these questions. All right, so a treatment-based, oh, this is your question to read. Who's up? Who's reading? Okay, Bobby Lynn read the last one. Roxanne, did you read for me?
Yes.
Anita read. Eugene, are you back? Okay, then I guess we're back to the first reader. Remember who you were behind. So my first one was Tanika, right?
Can I read it?
Yes.
I'm here. Sorry, I'm here.
Okay.
A treatment based on a nurse's clinical judgment and knowledge to enhance client outcomes is a nursing clinical judgment, knowledge to enhance client outcome. Is it an intervention?
Okay, good. And I just said that, right?
Yes.
Your interventions have to be catered to your goals or your outcomes, okay? Because if I'm doing an intervention that doesn't go with my goal, I'm not going to be able to, my patient's not going to be able to meet that goal. Like if my goal is to get that fluid off, then I have to do things that are going to get the fluid off. And we don't want them all to be invasive interventions. Okay, so you got to think about interventions and why would you use that intervention? What's your rationale? Okay, who was reading after Tanika? Go ahead. I want to say it was
So I'm not sure where I was, but
Lori.
I'll
I
just
think
go.
it was you after Tanika.
Okay. When a nurse assists a postoperative client to the chair, which type of nursing intervention does this represent? Maintenance, surveillance, psychomotor, or psychosocial? I would say C, psychomotor.
Good.
Yep.
All right, you got motor skills involved there, so that was a good choice. Okay, Anita, I think you were next.
A nurse encourages his client to maintain an ideal body weight. This health promotion behavior is an example of which type of prevention? Second, isn't it the same question I had?
Like the same.
It's not the same question. It's the same type of question.
Oh, okay. So we're dealing with ideal body weight.
So we don't want our patient to be obese and we don't want them to be underweight.
So prevention, primary. Would that be primary prevention?
Good. Okay, because secondary talks about like diagnostic tests and that type of thing, okay? Lucrece.
Okay, of the following types of nursing diagnoses, which one is validated by the presence of major defining characteristics? Nursing diagnosis, actual nursing diagnosis, possible nursing wellness. Major characteristics. Is it B, actual?
Good job. Okay, so, you know, when you're looking at your nursing diagnoses and also when you're looking at problems, because when you see problems, sometimes it throws you off. All right. You see a person that has an issue, but when you look at the issue, they don't have an actual problem, they have a potential problem. Meaning that they might say a person who had a white blood cell count and on antibiotics, leaving you to believe that that infection might get worse. Okay. If they're not showing the actual infection, just the possibility that it might get worse, you don't pick a potential problem over an actual problem. So if your patient has an actual problem, you're always going to side with that over a potential problem. Okay. Because the actual problem is actually happening right now. All right. Lori read, let's see, I think Roxanne, I think you're up.
It's the same. According to Maslow's hierarchy of needs, which nursing diagnosis has the lowest priority for a client admitted to the intensive care unit with a diagnosis of congestive heart failure? Lowest priority.
Okay, so now let's look at the answers. First of all, we have 3 answers up there that are actual nursing diagnoses because they don't say risk for, so that means they're actual. Okay, now, first one, A, ineffective airway clearance. So that has to do with oxygenation and all that. So which level does that fall under for Maslow's hierarchy?
Physical. High priority.
Physiologic, okay. Ineffective coping. Okay, where does coping fall under?
Self-actualization.
Okay, maybe self-actualization. What about impaired urinary elimination? What's that?
Physiologic.
Physiological. And body image disturbance, what would that be under?
Self-esteem.
Self-esteem, right? It's a higher level. And it's also a risk for, it's not an actual.
Mm-hmm. So it's the least one. The lowest, I mean. Lowest priority.
Okay.
So risk for body image.
Okay, so that's how you can do these. Think about where does it fall on Maslow's hierarchy? Which ones are actual? Which ones are potential? Mary.
Yes.
You're reading.
Okay. In the nursing diagnosis, disturbed self-esteem related to presence of red scar over the left side of the face. What part of the nursing diagnosis is presence of red scar over the left side of the face?
So the nursing diagnosis itself has different components, right? What are the components of the nursing process?
Is that the ADPI?
No.
Okay.
Like there's an etiology, there's a problem statement. What else?
Okay.
Let me see if I can find the page in your book that correlates with this. I want to say this might be chapter. $15. Let me get my book
Would
to
it
come
be
up
C?
so I can get the page number and everything for you guys on this.
And Ms. Sue, I have that in chapter 16 in the outcome identification chapter.
For nursing diagnosis?
Yeah, the parts of it.
Okay. It's in chapter
Well, there's
16.
a little chart Yeah, on page 395. I don't know if that's what you're talking about, but
I'm going there now.
Okay.
Just taking my book a second to get there.
Maybe the answer is A, etiology.
I thought it was B. I think the scar is the problem.
But this is
Well,
the
we're looking,
root cause. The root
so
cause.
etiology is the cause.
So the scar is the cause of the disturbed self-esteem.
Okay, let me see if I can get this.
Would it be the defining characteristic?
No, I believe it is the etiology. I was just looking for it in the book so I could go over it with you guys. Okay, so this is saying in the nursing diagnosis, disturbed self-esteem, okay? And that disturbed self-esteem is related to that large scar. So it's that large scar that's causing her to have a disturbed self-esteem. So it's saying what part of the nursing diagnosis is the presence of the large scar over the side of the face. So now you have to know what etiology means, you have to know what problem means, and you have to understand what characteristics mean. Okay, so this is the etiology because it's the cause of her low self-esteem. The problem itself is the large scar or the low self-esteem. Do you understand why?
you say the problem was the scar?
Or the low self-esteem, right? The scar is actually causing the low self-esteem, which is her problem. Her problem is the low self-esteem, right?
Okay. Mm-hmm. Yeah.
Okay, who just read? Who's next? Mary just read, right?
Yes.
Okay, Brittany, I think it's your turn to read.
What information provides the nurse with accuracy when developing a nursing diagnosis? A set of lab values, abnormal diagnostic tests, a set of clinical cues, or specific nursing interventions. D.
Specific nursing interventions.
Yes.
Thinking it's C, because it's those clinical cues that we look for when we develop a nursing diagnosis. And I feel like that would incorporate A and B.
Mm-hmm.
Okay, nursing interventions are what we're going to do once we determine the diagnosis.
Okay.
Eugene, you back yet? Okay, let's see who's next. Bobby Lynn?
The purpose of establishing a nursing diagnosis is to describe a functional health problem, collaborate with the physician, ID medical problems, or meet accreditation criteria.
A.
Describe a functional health problem?
Yeah.
I like it. Okay, we do collaborate with the physician, but when we do nursing diagnoses and interventions, this is something we can do independently. We don't usually identify medical problems. That's the physician. We're looking at, things that are caused by the actual medical diagnosis. That's usually what we're dealing with. And it's things that interrupt that person's, usually their activities of daily living. That's when we start to see them in. Okay, Bridget. Don't forget you're on mute. Okay.
All right. The primary purpose of obtaining a nursing history is to A, assist the physician to establish a medical diagnosis, B, minimize the time required to establish its cutoff, C, focus on objective physical data specific to the client, D, identify actual and potential nursing diagnoses.
So B said minimize the time required to establish a nursing diagnosis. So what do you think that we obtain a nursing history?
To D, identify actual and potential nursing diagnoses.
Good. I like it. Uh-oh. We're still going to do it. You just got the answer. That's all. Okay. Did everybody read a second time? Okay, then I guess you're back up again, Tanika.
Uh-oh. Okay, during the interview component of the health assessment, the nurse conveys to the client that information is important by A, nodding frequently during the interview, B, sitting at eye level with the client, D, standing next to the client while interviewing, C, and then D, limiting questions to those with yes or no answers. I'm gonna go with B.
C?
B.
Oh, B, sitting at the eye level of the client. Okay, good. You definitely want to sit at the eye level of the client. Now, we already know that in certain, populations, okay, we're not going to make eye contact, but you don't want to be standing over the client, okay? Because when you stand over the client, then that makes them, it's like belittling them. All right, so you want to make sure you give plenty of space and that you're sitting face to face with the client, but that you're putting that space in between you and the client, usually about 3 to 6 feet. Okay. All right. Next is Lucrece.
Okay, the home care nurse is preparing to perform a nursing history on a newly diagnosed adult client with a venous stasis ulcer. Which statement by the nurse is most accurate? A, when I perform the nursing history, I will need to ask your family to leave the room. B, I would like to perform a nursing history. This allows the healthcare team to get to know you better. C, I will perform a physical assessment while I am obtaining a nursing history. D, I will leave a form with you to complete the nursing history information I need. B.
Don't say the real word. Don't say the real world question.
B.
B as in boy.
Yes.
Okay, I like B as in boy. In the real world, we're probably doing C if you're a home care nurse. Why?
Time.
Yeah, because they're not going to give you that type of time to do your assessment. So most of the time in the home care, you get an hour, maybe 2 at the most, to go in, get your nursing history and do an assessment on that patient, do a teach, and then start whatever you're going to start, whether it's wound care, the IV, whatever. And it's damn near impossible to do all that even in 2 hours. So if you become a home care RN, you got to let them know that, okay? I let them know that. Like, I'm not doing this call because I can't physically and safely do this in an hour. It takes me an hour just to do the assessment and most of the nursing history.
That takes a long time because I remember where I used to work, we used to do the admission, and after the admission, right then and there, you have to do assessments and everything. That took over like 2 hours.
Yeah, it takes a while.
Not to mention medication reconciliation, calling pharmacies and all that other stuff that goes along with it. And they don't never have all the medications right there for you and all that other stuff.
Nope. And discharge takes almost that same time.
And you can't rush it, okay? Especially if you're dealing with the elderly population or someone who's on a lot of medication.
Yep. Oh, that list of medications sometimes goes on and on.
Okay, who's reading? Anita, I think you're up. It's not a health promotion question either. Guess what?
Okay. When a nursing is inspecting a post-operative incision site for infection, which type of assessment is being performed? When a nursing is inspect the post-operative incision site for infection, which type of assessment? Focus. Would that be B?
Oh, come on, computer. Focused. Okay, good. All right, so complete is like a full head to toe assessment. Focused is when we focus in on one area. General is just a general assessment, just like it says. And time lapse is going to be like if we're doing it every 4 hours, or like sometimes post-op, you might do one after 30 minutes, and then another one after an hour, and then another one in 4 hours. The crease.
Yes.
You're up.
I just read.
You did? I'm sorry. Anita, you read, right? Mary, then you're up.
Which of the following are examples of objective data?
Now remember, what is objective data?
What you can see.
We can see.
What you can see. So, can we see a client describing his pain?
No.
No. Can we see lab results?
Yes.
Okay, so we'll pick that one, right?
Okay.
Can we see breath sounds?
No. We can hear it.
Okay. Can we see that a client feels nauseous?
No.
Okay, can we see a client's temperature?
Yes.
Okay, so what's your choices here?
B and E.
The breath sounds, because you can actually hear those and describe them. So I it threw you off on the seeing, but because the breath sounds, you can actually hear them and describe them. Like you can put crackles, you can put ronchi, because you could actually physically hear those sounds. The client's not saying, oh, I have ronchi. Oh, I have crackles in my lungs, right? They're not going to say that to you. They might say the ronchi, but not likely. They'll say something like I'm hoarse, or I got a lot of coughing and noisy sounds in my chest. And then a temperature, yes, because you can measure it. Okay. Next is Roxanne.
A client asked the nurse, "What do you think of my physician?" The nurse states that the physician doesn't seem to care about the clients or how well their symptoms are managed. As a result, the client switches to another physician. The physician may have grounds to sue the nurse for A, malpractice, B, libel, C, slander, D, invasion of privacy. I go with C, slander.
Okay. Slander is when we talk junk, and libel is when we write junk. All right. If we're talking it, it's slander. If we're writing it, it's libel. Bobby.
A nurse ascertains that the client is showing signs and symptoms of dehydration due to nausea and vomiting. The nurse makes the client NPO and calls the physician. The nursing action of making the client NPO demonstrates which process?
So what's our general systems theory? What's that? It's the sum of how all parts work together, right?
Yep.
All right, what about problem solving? What's that? Not really sure that she solved the problem here. She may have stopped the person from vomiting, but not necessarily. But one good way to try to stop him from vomiting is to do what?
Don't give them any food.
Yeah, don't give them any PO intake, because if you put something in, it's going to come back out. All right, so more than a problem solving process, she really did what here?
Made a decision.
Yeah, she made a decision that until the physician comes, she's going to keep the client NPO. And then hopefully, you know, the client's going to make some other decision. We might have to get the patient compazine. We might have to start them on IV fluids. We don't know what we're going to have to do. And then information processing theory. I don't know this one offhand. I mean, she did process information and put it together. Not sure that it falls in that category.
No decision making.
Okay, so she made a decision for the good of the patient, and she put that decision into place, okay? Bridget.
The nurse prepares a narcotic pain medication and gets distracted before administering the medication. Later, the medication is administered to the wrong person. What type of law addresses this problem? I'm gonna say the Controlled Substance Act.
Okay, so, you know, they like to try to trick you. So that's why they put that there, because they know you're going to say that. I think that this falls under civil law because I believe that the Controlled Substance Act is to do with how we discard controlled medications. Like that, we have to have 2 people to waste it. It has to go in a certain substance or a solution that's authorized by the Food and Drug Administration. I want to say this is civil law. I could be wrong. She didn't purposely do it. All right. It could be under a different law if she purposely stole the medication or diverted it. All right, here's your rationale. All right, civil laws or torts are when an unintentional, meaning she didn't intend to do it. Okay, negligence is when we do unintentional harm because we didn't act in a responsible manner. Like, you know, your patient is going, you know how they read in the questions, you'll see a question, it'll say, your patient's blood pressure was 90/60. Should you check it, go on break, come back, recheck it in 15 minutes? You know, if you don't recheck it, you're negligence. Now, if you don't recheck it just because you didn't think it was an issue, you didn't intentionally do the harm, then it would be failing to act in a responsible manner. If you intended to do it, then it would be something different. Vicarious liability would be if someone else contributed to that error. And then the Controlled Substance Act is about how the medications are manufactured and distributed. The Nurse Practice Act is about administrative law. Okay, I think you're back up again to keep Danica.
Okay. The nurse is preparing to send a client to the radiation department for his scheduled radiation therapy. What action will the nurse take to determine the correct identification of the client? A, ask the client his name and then repeat his name to him. B, ask the client's name and date of birth and compare the response against the identifiers on the order requisition or medical record. C, check the client's armband against the identification records on the chart. And D, check the doctor's order on the client's chart and determine whether he is to receive any medications before the treatment. I'm gonna go with the response against identifier. Is it B?
Good. Okay, Anita, you're next. Oh, the Joint Commission requires 2 points of objective identification. For the client with an armband, it's recommended that the nurse check the chart against the name and date of birth on the armband. Asking the client for just his name is only one identifier. And I've seen clients give the wrong name. Asking a client, just checking the armband is not sufficient enough because the client should participate in the identification. Checking the doctor's order on the chart should have been done before to verify the correct order, not the client's identity. Okay, sorry, now Anita, you can read.
A client complains of weaknesses following his admission of insulin. The nurse decided to assess the client's blood sugar and prepare a snack in case the blood sugar is low. What action has the nurse implemented? Reason, care, reflection, assessment. What necessary? Weakness. B.
Caring?
Oh, no. The nurse decided to assessment. D. Am I right?
Well, she did use assessment.
Says the blood sugar and proportionate. Is it a clinical reason? No. He says you have to think. It says the blood sugar and proportionate in case of blood sugar is low. A clinical reason.
Okay, good. So, she gave him the insulin, then he started to complain. She did an assessment of the blood sugar and she went ahead and prepared that snack just in case. So that's what's cluing you in. She's making clinical judgments, using clinical reasoning just in case. I call it being a good Girl Scout because, when you have everything prepared, stuff is less likely to go wrong. Forrest Gump says shit can happen and it's going to happen. Okay? You just have to be prepared for it. The crease.
Okay, unjustified retention or prevention of the movement of another person without proper consent can constitute which of the following term? And prevention of movement, false imprisonment.
Okay, false imprisonment, good. We hold somebody against their will in any form, it's false imprisonment. Roxanne.
An unexpected occurrence involving death or serious physical or physiological injury, or the risk thereof, best describes which following legal term? Malpractice?
No, serious physical or psychological injury that involves death or the risk thereof is generally referred to as a sentinel event.
Okay.
Okay. Mary.
A client is suing a nurse for malpractice. What is the term for the person bringing suit? A.
The plaintiff. Lori.
Which of the following is the most frequent reason for revocation or suspension of a nurse's license? A, fraud, B, mental impairment, C, alcohol or drug abuse, D, criminal acts. Most revocation or suspension. I'm going to say C.
Yes. The least of the ethics, okay? We got to get our drink on.
That's awful. I'm sorry, I'm laughing about that.
Hey, listen, we're human too. And it's sometimes the things we do that makes us get our drink on, like this COVID situation we're in right now. But you want to hear the most ridiculous thing is, and believe me, I'm not an advocate for or against, but I have a nurse that recently tested for marijuana, I'm going to say within the last couple of weeks. And they sent her to a rehab in Florida. I'm like, are you freaking kidding me? For 30 days? Like, are you kidding me? The shit's going to be legal in this state in 2 weeks. Like you said, you really put her off duty without paying, made her go to Florida for a month.
That's a free vacation.
Free vacation.
Looking forward to it.
Yeah.
I mean, yeah, to Florida for a month, but she probably needs her weed if they sent her down there.
You went there?
Sorry. Did I say that?
No.
I'm just saying in the COVID situation, and now you're sending me to a place that's really high with COVID numbers.
Yeah, exactly.
I mean, you couldn't put me someplace here in New Jersey?
Mm-hmm. Yeah. Sent her right to the hot spot,
Right.
or the hottest of the hot spots.
All right. Bobby Lynn.
A lawsuit has been brought against the nurse for malpractice. The client fell and suffered a skull fracture, resulting in a longer hospital stay and a need for rehab. What does the description of the client represent as proof of malpractice? Damages, causation, duty, or breach of duty? Would it be causation?
Damages. All right. It's their damage, that's that proof of the malpractice. So they got injured because they fell. So it's that damage that was done to the body is the proof that the nurse didn't do what she was supposed to do.
So what would have been the example of causation? That maybe she didn't put the side rails up and that's why he fell? Like something like that is causation?
Yeah. What caused that to happen?
Okay.
What is the legal source of rules of conduct for nurses?
D.
D, Nurse State Practice Act. Okay, good. A nurse states to the client that she will keep her free of pain. However, the family wishes to try treatment to prolong her life that may necessitate withholding pain medication. This factor will cause an ethical dilemma for the nurse in relation to which ethical principle?
Fidelity.
Okay, so fidelity is breaking a promise. So do you feel like the nurse broke a promise here? If she does this, withholds the pain medicine?
Yeah, because she said she's gonna try to keep her free of pain.
Yeah, she
Okay, so that's breaking a promise. Veracity is truth telling. Justice is trying to make everything equal for everybody. And then autonomy is allowing the patient the right to refuse or make their own decisions. Okay, good. The nurse inserts an ordered urinary catheter into the client's urethra after the client refused the procedure. The client suffers an injury. The client may sue the nurse for which type of tort?
A.
A, battery?
Yep.
Yeah. So assault is when you threaten, okay? I'm about to whoop somebody's ass. That's assault. I'm about to whip somebody's assault. Okay. Battery is when you actually touch. A client is in a clinical research study has given informed consent. This means that the client has certain rights. These rights include which of the following? So do they have a right to confidentiality? True or false?
True.
Do they have a right to free medical care? True or false?
False.
Do they have a right to protection from harm? True or false?
True.
Do they have a right to guarantee of treatment? True or false?
False.
Do they have a right to consent knowledgeably?
Yes.
True.
Okay, they have a right to protection from harm and consent knowledgeably. And they do have a right to a certain amount of confidentiality. I'm not sure why this isn't clicked in here, but you can't openly, like there's going to be a certain amount of confidentiality. If it's a survey, it'll give information about the client, but it won't give enough information to reveal who the client is. Which of the following statements are true regarding the nurse-initiated interventions? Do they promote independence of activities with daily living? Nurse-initiated interventions.
Yes.
Okay, do they give clients information they need to make informed decisions? Nursing interventions, nurse-initiated interventions. Okay, do they resolve, present, or manage client problems?
Yes.
Do they require a physician's order to be carried out?
Yes.
No.
No.
Okay, like you can encourage fluids and do stuff like that, okay? You don't need an order. Now, here's what you might want to think about though. If my patient's in fluid volume overload, okay, it might not be something I want to do. But if my patient is dehydrated and they can physically drink on their own, then I might do it. If my patient was in a hypoglycemic episode and they were conscious enough to eat or drink, then I would give them that before I would give them glucagon or some medication. Do they aim to treat or cure a medical diagnosis?
No.
No.
Okay, so A, B, and C, they resolve, they promote independence, they give clients information to make informed decisions, and they resolve, prevent, or manage a client problem. The nurse instructor is teaching a group of students how to correctly write diagnoses, nursing diagnoses. Which of the following nursing diagnoses are written correctly? What do you think? Which ones look good?
A, B.
B?
B.
B as in boy?
Yeah. I think it's A, B, and C. A, B, and C.
Okay. Good. Diabetes mellitus is wrong. Why?
It has a medical term.
Okay. Remember that when you write your nursing diagnoses, because that's the biggest problem I see with the care plan. You can have ineffective, fluid volume overload related to ineffective compensatory measure, okay? Because your heart isn't pumping or your ejection fraction isn't doing what it should be, and your kidneys aren't compensating for that, okay? So that's how you would kind of write that. Which statement by a nurse meets a third level need according to Maslow's hierarchy? So first level is what?
Physiological.
Second level is?
Safety and
safety and security. Third level is?
love.
Love and belonging. Fourth level is?
Self-esteem.
Self-esteem. And fifth level is?
Self-actualization.
Okay, so we said third level is love and belonging.
C. C.
See, it is. The prospective nursing student is trying to decide on which nursing program to attend. She's examining the nursing philosophy of each program. She believes that the essence of nursing is to help the person to adapt to changes in physiological needs, self-concept, role function, and relations. Which of these theories would most likely meet her needs?
B? Is it B? Roy's adaptation theory?
Good. All right, this should be cake work for you because we just did this, right? Three, 5, 4, 2, 1.
Yes.
That's my number. The physician orders IV pain medication for a client. The nurse caring for the client administers the medication through the IM route. The nurse learns from the error. This action, the doctor ordered it IV, the nurse gave it IM. The nurse learns from the error. This action is considered which type of practice?
Reflective?
Yeah, reflective. She
Okay,
learns
good.
from her error.
Good. Which nurse is demonstrating the assessment step of the nursing process? So A is what?
Evaluation?
Okay. B is what?
Is that implementation?
Okay. C is what?
Maybe that's assessment.
Okay. And D is what?
Is D planning?
Sure it is. Okay, good. So C was the assessment. Nursing instructor is teaching a group of students about the nursing process. In which order will the following activities most likely occur? So what is our nursing process? And that's how you're going to put these in the order.
Is it?
Nobody, you can't be
quiet. B.
A.
Yeah.
4, 2, 1, and 3.
3.
It's oh, hold on.
4, establishing a database, you guys are saying, and then measuring the outcome, and then carrying out the plan, and then modifying it if needed. Is that what you're saying?
No, measurable shouldn't be.
B. 4, 2, 1, 3.
4, 2, 1, 3.
Yeah, it's B.
So you guys want B. 4, establish the database, carry out the plan, measure the outcome, modify if necessary.
Yes.
Yeah.
Okay, B, 4, 2, 1, 3, good. Which of the following is an example of delivering culturally competent care? Seeking assistance from the charge nurse so the client may accept care. Allowing the client to make decisions about care. Coerce the client to participate in care that is in conflict with their belief. Provide care with the knowledge that the provider's culture is superior to the client's.
B.
B as in boy?
Yeah.
Good. Which of the following is an example of never events?
C.
Yes.
Okay, good. C.
Definitely C.
The Nurse Practice Act protects the public by broadly defining the legal scope of the nursing practice. Which of the following nurses is within their scope? A registered nurse caring for a client on the surgical floor, writing a prescription for a narcotic for the client. A registered nurse caring for a client on the surgical floor, discontinuing a plan. A pain medication because it does not work for the client. A registered nurse caring for a client calls an outside pharmacy to find out the name of the narcotic the client is taking. A licensed practical nurse performing an admission assessment on a client admitted to the medical floor at a local hospital diagnosed with a bowel obstruction.
C.
C.
You say D as in dog?
C as in cat.
C as in cat.
Okay. All right, that was it for that one. Let's see, I think I got another one now.
So, Ms. Sue, are these the types of questions that are going to be on our midterms? Things like that?
It should be similar to these types, but it may not be the exact questions, but it should be
All right.
based on the same similar content.
Okay.
I have in the freezer. Ms. Soch.
Yes.
I know it's almost over. I have a question. I know since you're one of the deans regarding nutrition, is there any way they can provide type of an app or something so we can do practice questions like that for nutrition?
Yeah, there are practice questions from nutrition. Does Miss Clark go through them with you in class?
Yeah, but I just
there's
wonder
an
if
app.
there's something we can do. We can do ourselves.
There is an app. You have to go through that nutritional program to do it.
Yeah, I saw that. It's like it's a whole to do. But I thought
I've
they
tried
have
to
something
get
like
into it, and I really haven't been successful with getting into it.
Me neither.
Yeah, I did call her, I think a day before yesterday, asking about the same thing. Like we can find maybe a site or like we have prep you for nutrition. And she said, no, we can just Google it. There are a lot of questions online. Those are, you know how we did the gameplay, something she had it?
Yeah.
Was saying that
Jeopardy she had for you?
she
Yeah,
said
but that thing you have to do with someone. I need something I can study on my own, like prep you.
it's a game that you have to do with like a couple people. You can't do it on your own. So I did call her because I was like wondering if we can have some practice kind of questions. But she said no.
I mean, I might have something I could send you guys. It might not be, I don't know if it's the same type of questions that you're going to get. It's from stuff that I used to teach on nutrition. It might help you.
Because nutrition can get pretty tricky. It gets into microbiology, it gets into, you know, some type of hard stuff. If you haven't had it in a while, some of these things are not that hard, not easy. They're not easy to remember.
Let me see if this is going to pop open for me. Is this what you guys did?
Oh, can't see it.
Are you talking about that game that we played that day in her class, like Kahoot?
Yeah, that game. You have to have another person or a group of people.
Let me know when you can see my screen. Can you see my screen? Oh, you still see the PowerPoint we were on?
Yes, PowerPoint.
Miss Sonia, is that my water? Can I have it? Thank you.
No, we didn't do that. We did Kahoot.
Okay, let's do some of it. We got about another half hour. Now, I'm doing a class with you guys. When is your nutrition midterm?
Monday.
Monday.
Okay.
You know, they changed the time of that. Did you guys see that?
Yeah.
4 o'clock.
Who's going to be
No,
around
they
tomorrow
changed it to
night?
5:30.
My email came back and said that they made an error that it is at 4.
Oh, they did? Oh, I didn't get that
Yeah.
one.
The
Yeah,
initial
check your
one said
email because I'm
5:30.
pretty sure there was another email that went out about that.
So it is 4.
It's at 4 o'clock?
Yeah, I believe it is. I saw an email from Miss O. Somebody asked about it.
Oh, okay. Thank you.
But check your email. Okay, and if you're not sure, send an email to the IT team and CC me on it.
Okay.
Okay, so how many of you guys are going to be around tomorrow night?
Me.
I don't know. It probably would be like around 8 because I have tutoring sessions in the morning and then I need to go meet with someone in the afternoon for a little bit. So then by the time I get back home, it's probably going to be like 8-ish.
That's fine with me.
So I can try to, I mean, we'll do some of these Jeopardy questions now. We have about a half hour. Okay. And then I'm going to do another L to R tutoring session Tuesday night from 8 to 10. So we can work on a few of these now, and then we can meet tomorrow night around 8 if you want, and I could try to go through some more with you.
Okay. That'd be great.
All right. What is nutrition? An old scientific discipline, the science of gourmet food and drink, the science that encompasses everything about food, the same as the study of culinary arts.
C.
Okay, how does this thing work? Now I just have to figure out how the stupid thing works. Maybe I got to go to slideshow.
There's an answer button there.
Yeah, it didn't work. Okay, so I guess it was the role of nutrition for 100. I had to go and click on that and then answer. The science that encompasses everything about food. Okay, now anybody can pick, or we can just go through them. You want me to just go through them to save time?
Yep.
Okay, so then we're going to go to nutrients for 100. This way we can try to hit a couple different chapters. All right, nutrients are organic chemicals found in food that are critical to human growth and function, chemicals that are important but not essential to human growth, chemicals found in food that are critical to human growth and function, chemicals that our bodies can make and are crucial to human growth.
See?
Chemicals found in food that are critical to human growth and function. Dietary standards. The DRIs are define recommended intake value of various nutrients for people suffering from chronic illness. Define recommended intake values of various nutrients for all people. Dietary standards antiquated and no longer in use. Define recommended intake values of various nutrients for healthy people.
The
last one.
Okay, good. The standardized method used by researchers when looking at evidence is hypothesizing, the scientific method, examination, or scientific diagnosis.
The B, the scientific method?
Or maybe C, examinations? Oh, okay.
Scientific method. Good. Which of the following abbreviations or terms is used to describe someone who has completed a registration exam for dietetics?
C, is it C?
C.
C.
Okay, C, registered dietitian. Consuming a nutritious diet contributes to our wellness in all of the following ways except. Go ahead and read the answers.
Fight infection. Increase our ability to concentrate.
Supports activities of daily living, strengthens our abilities to fight infection, increases our ability to concentrate. All of the above contribute to our wellness.
D.
D, all of the above?
I think
That's
it's
what I said.
D.
Oh, wrong way. Okay, good.
But if it's all of the above, why is the question saying except? Like,
Distractor.
oh my goodness.
It's probably just a typo. Let me go back to the question. I don't know if I can go back to the question. It was probably a typo. Oh, come on. Now it's stuck on stupid. Come on, machine. Stop my sharing, see if it'll cooperate. Not cooperating. Sorry, guys, it's stuck on stupid. My computer right now, it's just spinning. Well, anyway, we'll get a good 2 hours on this tomorrow night. We'll go through a lot of, we should get through a lot of these questions.
Okay, that would be really helpful for Monday. Thank you.
And I'll be at home, so hopefully the service will be a little better. Right now I'm at the school. I don't know if it's the school or not. It's just acting stupid. It's just spinning. I can't even get out of the program. It won't even let me out. Let's try this. Let's just shut you off. What chapters are you guys currently working on? Do you know offhand?
I think it's 1 through 6.
The midterm, I believe, yeah.
Okay, let's see if you can see my screen now and let's see if it'll work.
Actually, I think it's chapters through chapter 7.
What is it?
I think it's 1 through 7.
1 through 7?
Yeah.
Okay, with what 3 chronic diseases is nutrition strongly associated? Can you see my screen?
Yes.
Yes. A.
Heart disease, stroke, and diabetes?
Yeah.
Mm-hmm.
Good. What 2 nutrients are usually the primary fuel for sources in the body?
B.
Carbohydrates and fats?
Yeah.
Okay, when do we burn fats?
Working out and
Okay, or when the body doesn't have any carbs, right? Or when it's going into ketoacidosis.
yes, hold on. Alicia.
All right. What's the kcal on carbohydrates?
Is it 4?
Okay, how about proteins?
Let me and ditch me. Why did you do that, Nina?
Is it the same 4?
4, and what about fats?
9.
Okay, good. Which type of vitamins are water soluble?
A, D, E, and K.
Those are all fat soluble, okay? A DEC is fat
okay.
soluble, meaning that the body will retain them. If you continue to eat them, the body will just keep sucking them up and holding them in the fat cells. That's why you can't take too many of those vitamins. The water solubles are going to be your B's and C's. What's the difference between the EAR and the RDA? One difference. Okay, here's your choices. RDA defines intake value for sick people, while EAR deals only with healthy people. RDA is not gender or age specific. C, there is no difference. D, the EAR represents intake levels for just half of the healthy individuals of a particular gender and age group.
I think it's D.
Okay, everybody else? Okay, good. D. The first step in the scientific method.
Observation.
Everybody think it's observation, the first step? Okay, good job. Which is in the correct order? Observation, hypothesis, data collection. Observation, data collection, hypothesis. Observation, hypothesis, experimental design. Observation, experimental design, hypothesis.
B.
B as in boy?
Yes, B as in boy.
C, observation, hypothesis, experimental design. Observational studies inform us of what?
In effect.
I want to say it's A. I'm not 100%, but that sounds correct. Oh, actually existing relationships, okay?
Okay. Existing relationship.
Which of the following is not a key question when evaluating a company's website?
Is it C?
How much traffic does the website receive each day?
I don't think that matters.
Good, it doesn't. Nutrition has been shown to play a minor role in which two diseases?
A.
Good. Some cancers and osteoporosis. Some diseases are the direct result of nutritional deficiency or toxicity. The disease blank is caused by a deficiency of niacin.
Is that C?
Pellagra?
Yeah.
Good.
Niacin's a B vitamin, right?
Huh?
Is niacin a B vitamin?
Yes.
Mm-hmm.
Okay.
We already did this one, so let's go back to the game and go to the next. Macronutrients. Which ones are those macronutrients?
I'm guessing A.
A, yes. Carbs, fats, proteins, okay? Which two nutrients are usually the primary fuel for sources in the body? We did this, but we'll do it again. Carbohydrates and fats. What is one major difference between vitamins and minerals?
Maybe B.
I'm kind of thinking about C because when we cook certain foods, it loses their thing. But let's see about B. It could be. I don't know the answer here. I don't think it's D because minerals are usually, I think, divided into two categories too, between trace and something else. So let's see. There you go, B. You're right. We did this one. We did that one. Which of the following values is based on observations or experiments involving healthy people and used when the RDA cannot be determined?
Let's see.
AI. Good. What is the EEE? What is the EER? Anybody?
I don't know.
The average dietary energy intake that is predicted to maintain energy balance in a healthy individual. So how much do we need to intake? How much dietary energy do we need to intake in order to balance our energy in someone or to balance the energy in someone that's healthy? The AMDR is what?
Is it D?
It could be. I'm thinking it's C though, but let's see. Okay, defines a range of macronutrient intake associated with reduced risk of chronic disease. The standardized method used by researchers when looking at evidence is called what? We did this one, the scientific method, right?
Right.
We did this one. The first step in scientific method is observation. And we did this one. I think we might have did all these. Okay, if you were basically healthy and wished to lose weight, who would be the most qualified to offer advice?
RD.
Okay.
B.
Which two organizations are considered reputable government sources of information about nutrition? The NIH and the CDC.
Oh, he was right.
The largest organization of food and nutritional professionals in the world is who?
Is it D? Oh, no. It
B?
says diabetic. I read that wrong.
So C, you're thinking?
Probably.
Academy of Nutrition and Dietetics. All right. So what is a nutrition quackery?
B.
B, the promotion of an unproven remedy, usually by someone unlicensed and untrained for financial gain. In response to protests, which company recently withdrew funds from several healthcare organizations?
General Mills.
The meals, Coca-Cola.
Ooh.
All right, that was all the ones on that slide. So you said 1 through 7, right?
Yes.
A substance composed of molecules that moves freely and conforms to the shape of their container is known as?
You can't see it.
Oh. You see it now?
Yeah.
Yeah. Fluid.
Good. How much of an adult's body is held within the walls of the cells?
A.
2/3? Good.
Yeah.
Which type of fluid are cerebral, spinal fluid, mucus, and synovial fluid?
Is it B?
I think it's B.
Say the
Right. Thinking A. Huh?
sometimes say the
Tissue or interstitial? Lean tissues are more than blank fluid by weight compared to blank in fat tissue. So fat tissue is going to be extremely low because fat and water don't go together. All right, 70% lean to 10 to 20% compared to fat. All right, guys, we'll pick this back up tomorrow at 8 o'clock. You can jump right in through the school link, but I'll still send out an email just to remind everybody.
Okay.
All right. Thank you.
Any questions before you jump out? Or you
Thank
good?
you, Ms. Loesch.
You're welcome.
Thank you.
You're welcome. Have a good day.
You too.
Hello. Good, how are you?
Okay, were you out?
No, I'm studying.
Oh, I'm
Give me
sorry.
1 second, Davida.
I'm okay.
Oh, okay.
No, I just